your credentials, you can do online, and we'll come and inspect you later to give you what you need to get to. NHIA has also linked itself to the Ghana Household Registry at the Ministry of Gender to ensure that no vulnerable person is left behind. This has been a very common phrase within the health system across the globe. Anytime you talk about universal health coverage, the next thing that follows is that no one should be left behind. To try to pick everybody along with us, we have actually joined with the Ministry of Gender that has a facility that identifies very poor, vulnerable people, so we can pick them before they even know we are coming to register them. We have worked so far on our costing of services that is completed now, awaiting for certain approvals. That is what I call the new tariff regime, which will give a little bit more money to providers to be able to take care of our people. Family planning has been piloted again successfully, and it will soon be added to the benefit package. Remember, in the party's manifesto, we say we'll expand NHIA coverage, benefit package, and that is where we are moving to. We have done costing for childhood cancer and prostate cancer, and this will also soon be added to our benefit package. Again, we are doing serious costing on prevention services, such that soon, if you are successful in that endeavor, we will begin to add cases like hypertension and diabetes for prevention, again, onto our benefit package. The NHIS has actually launched a YouTube. This will give regular information updates to the public. And we'll also use the Health TV as well to try to do public education, health education to our population. Despite these remarkable achievements in NHIA, unauthorized or illegal payments are rising in most of the credentialed healthcare facilities through different forms. This week, a radio station started airing a documentary they produced on out-of-pocket payment at selected health facilities in the Greater Accra region. Last Monday, on the 14th of June, the station aired excerpts of the documentary from two facilities, Mamprobi Polyclinic and Mamubi Polyclinic. Together with NHIA and Ghana Health Service, a joint monitoring team visit will be undertaken soon to address the issue. But let me announce once again, I have said this here before, that the ministry has set up a small unit within its PPME directorate. We call the Health Intelligence Gathering Unit. It is commissioned to pick information and investigate illegal payments at the various healthcare facilities for prompt action to be taken. That is not the only demeanor. Several other facilities that are operating without licenses from HEFRA, licenses for their health professionals from Nursing and Midwifery Council, from Medical and Dental Council, from the Allied Health Professionals Council, and all the regulators. The Health Intelligence Unit is assisting on their way. When they find those things, we will refer them to you for investigations and further necessary action. My colleague minister, let me thank you, ladies and gentlemen from the media. I'm very grateful for your audience.
Minister, we're grateful for the briefs that you have shared with us this morning. And these three briefs, if I was following you properly, are very rich on data. You've given us a lot of data. So I think one of the first things we'll do is that I want to ask our colleagues in the production suite who manage the press pool platform to please make the presentation available with all the data in it. And then I want to ask of you, our colleagues, there are a lot of stories that you report on the health front, and it is right that you report when you hear worrying stories about, various things. But when we also make information available full of data like this, that shows the kind of collective progress we are making. We beg of you to make time to highlight and interrogate this data that we have put. Don't brush it aside and let's move to the next bad story. Let's make some time also to interrogate this data. Is this data that the minister is putting out here, is it true in the first place? And if it's true, what does it mean for us? For example, if the doctor to population ratio is improving or has improved, what does it mean for us? Is it true it's improved as significantly as he says? And if it has, what does it mean for us? The Nhis to population ratio, is it true we are doing better than the WHO standard now? Is it true? This is the minister's claim. And if it's true, what does it mean for healthcare delivery across the Republic? Doc, as you were talking about doctor to population ratio and the fact that there's, however, an imbalance, you find that a lot more of the doctors want to go to Accra and Kumasi when in many other districts we need doctors. In my district, Achimansa district, Dr. Kranting Ampao Prince, thanks to your ministry and your directors who are here, he has come and he is working there. So I just thought I should let you know. Say again? Because of what I did. Well, yeah, because we also offered some incentives, as well. So I just wanted to mention that not all the doctors want to come to Accra and Kumasi. Dr. Kranting Ampao Prince is in Achimansa district. Colleagues, that was just by the way. It's a good time to take your questions now and to interrogate all the things that the minister has put out. Also, in particular, the developments on the NHIA front. So, Minister, you're saying that active membership has moved from about 40.6% in 2016 to 52% as at the end of 2020, which means that as at the end of 2020, 52% of our population is now actively using the National Health Insurance Program. That should be my understanding. I think I understand you clearly. Colleagues, let's have the microphone, and it's a good time to take your questions, and then we'll provide answers to them. You know we like to be biased towards the ladies, so I see you, the gentlemen, but let me see if I'll find ladies to start with. Any ladies? So let me start with my gentleman. I'll take the first three plus one at the back, making four, and then we'll continue. Please introduce yourself.
Okay. Thank you, Honorable Minister. My name is Paul Nyoja Dalafo from the Daily Statesman.
From the Statesman. Please speak up a bit.
And my question has to do with, Honorable Minister, what happened to the persons who have failed to renew their health insurance membership within a year after expiring or more? And also, some doctors or nurses refuse to go to their postings in the rural areas. Have you done anything to improve their living conditions there, that they can be safe there to work? So I have a question that has to do with some personnel. Also, sometimes when you get to the hospital, you see the nurses, instead of attending to you, the moment they see you, they begin to touch their phones and flipping through their phones to see what is going on. Have you taken your time to investigate these things as to whether it hampers on health of the patients? Thank you very much.
Thank you. So you want to know about persons who fail to renew their NHIA cards. Are there consequences? NHIA boss is here. And for the heads of the agencies who are here, Minister, with your permission, can I invite some of them to answer some of the questions? Very well. So NHIA, please take note of that. I'll bring you up. There's a question about doctors and nurses who refuse postings to some of the rural areas. Is there some policy position on what sort of incentives or what to do in a scenario like this? Dr. Patrick Abuaji is also here, Ghana Health Service. So please also make a note of that. And then there are reports of poor customer service by some persons in the health value chain. I think it's better to broaden it that way. Some of our nurses, many of our nurses do a very, very, very great job. But there are still reports of poor customer service. What is the policy position on the poor customer service in the health value chain that is sometimes reported, and what can be done about it? Yes, sir. There's a hand at the back. Yes, sir. Please introduce yourself.
All right. Thank you very much. My name is Abu Bakar. I work for Tinka TV. I want to know if there's anything, or there's any plan for Ghana to be able to produce vaccines locally. Is there any conversation like that?
Yes, there is. I think it's been announced. I mean, the president has spoken about it, Dr. Nhis. So yes, there is. But beyond the fact that there is there anything specific you want to know? So I think it would be fair to know the status of the conversation or the program, because that one is clear, there is. But the status of the conversation is a matter of interest. And then let me take these two for the first one. Yes, sir.
Yeah, thank you. My name is John Awuni. I represent Kesbin. I just wanted Minister to give some updates on the President's COVID address to the nation. He did mention 88 district hospitals were going to be constructed. I want to know updates on that. How far has the project gone? Thank you.
Thank you. 88 district hospitals, then later, in the words of Chairman Sabunsu, transmogrified to Agenda 111. We'll get answers. GNA.
Yeah, Honorable. My first question is, as the Honorable Minister said, those who have taken their first dose, if they couldn't receive the second dose within the 8 to 12 weeks, shouldn't be worried because they will still be protected. And I want to find whether he's saying it based on scientific proof, because in recent times, doctors have been telling us that within 8 to 12 weeks, we should take it. And so if now we are saying, even after this period, you don't get it, you shouldn't be worried because you'll be protected. I want to find out whether he is saying based on scientific proof.
Dr. Abuaji, please take a note of it.
Then two, as you rightly said, you have set up health intelligence unit to deal with these illegal payments in our health institutions. I want you to give further indication as to the sort of punishment that will be meted out to offenders who are taking those
Which
things.
particular offense are you talking about?
Like, he is saying that they will take prompt action against maybe health officers who are caught taking illegal payment or something like that. I want him to give us detail as to a specific punishment that will be meted out to those people.
Okay, on the matter of illegal payments for health services, are there any sanctions? Very well, very well. I'll come to the back. Let me see. Okay, this is a first batch of 4. So I think this is what we'll do. This is our first batch of 4. Let me ask health insurance. Dr. Janice Albe, please join us and take off the issue of persons who fail to renew NHIA. And you may want to even touch on this other question. Please come this way. The staircase is here. For those who are taking illegal payments, are there any sanctions? You may want to deal with those for me. Then 88 district hospitals, I'll go to the minister, as well as the vaccine local production question. I'll come to the minister. And Dr. Abuaji will deal with doctors and nurses and then poor customer service for us. Dr. Selby.
Thank you very much. The NHIA has a policy that if you default by more than 3 months, when you renew, you serve a 1-month waiting period. I think that's the policy in most insurance systems. The only people who are exempt from that is pregnant women and children under 5. We all know that children under 5 can be seriously ill, sometimes in the space of an hour, and we can't afford to wait. And for pregnant women, obviously, it's free, and we need to get them treated. Everybody else, you serve a 1-month waiting period. And our system is hardwired. You cannot pay somebody within NHIA to take away that unless they register you as a pregnant woman or a child under 5. A few have tried, and we've caught the staff and sanctioned them. Illegal payments. We have a call center. Those who call, we follow up at the facility, and we have been able to take the money back and give it to the person quite a few times. But what we find is patients are very reluctant to report perceived wrongdoing at health facilities. We all know what we feel about a hospital and healthcare. You never know when your turn will come. So people are very reluctant to report. But a few who do, we are able to get their money back. Myself and Dr. Abuaji, we're doing some research around this to see what we can do to halt the spate of illegal payments. And as progress comes along, we'll keep you all informed.
But it's important to report so that some action can be taken. Dr. Abuaji, let me invite you to the podium. Doctors and nurses who refuse postings, what is it? And then reports of poor customer service. What can you say about that? And then I'll invite Minister to deal with the other two.
Yeah, thank you very much, Honorable Minister. Yes, the issue of refusal of posting is a major headache. We have seen two key issues. It's more of perception and obviously deprivation in those areas. So what we have also noticed is that people hear a certain region and they say, I won't go there because they really feel there's nothing there. And we've started looking at going around the medical schools just before they graduate to introduce them to this region. I've also been speaking to the regional ministers and the district directors that market the region. I've just returned from Northeast because it's a very nice place, but people have this perception that it's just like a bad place that nobody needs to go to. So I think we also need to market. But we've also put incentives that after 2 years, you are eligible for transfer if you want to stay. These are some of the things we are doing, and also trying to ensure that accommodation is provided for those who go there. Because sometimes, even if you go and you have money to rent, you may not find a place to rent. So these are some of the challenges, but we're trying to get over them and ensure that people are able to take a posting from there. So we continue to work at non-financial incentives for them to go there, whilst we are looking at some possibility of a financial incentive. The minister has set a committee to see how they can create something that will attract people to these less endowed regions. Staff attitude remains a problem. And the minister said about 95% of the people do the right thing. But that's what they're supposed to do. It's the 5% or 1% who do the wrong thing that's of concern to us. Currently, we do investigation. We have a report of somebody from some part of Accra, which we are currently investigating the person's attitude. We also, as a service, trying to brand ourselves. And the branding is not just about how we look, but also branding the people to behave appropriately. And we are seriously working on that to ensure that this is reduced. But the most important, that people must report. And if they report, we make sure that now when we punish them, we let everybody know that some sanctions have been taken so that it will also be served as a deterrent for the others. Do I go on the vaccine?
The local vaccine production program.
No, 6 months.
Yes. Please deal with that. I think I missed that one.
Currently, I think...
What's the science behind it?
For COVID, everything is still ongoing. And so we started at AstraZeneca, the repeat was 3 weeks. And we realized that 8 to 12 weeks was better. We also know that further evidence has shown that even beyond the 12 weeks, since we get protected, even though we may have a reduction of about 34% of the antibody, we still are protected even up to 6 months. But of course, for vaccination, what is most important, the duration between the first and your booster dose. That's the earliest time. And so even though you may not be as protected as somebody who has the peak antibodies, but you still have some significant protection, either from severe disease, infection, and death. And so that's what it is. So there's some science behind the extension that even those who have had one dose are better protected beyond the 12 weeks than those who are not taking any vaccine at all.
Thank you. I want to invite the Honourable Minister to respond to the outstanding 2 issues, the 88 district hospitals, and then the status of the local vaccine production program. And then I'll come for the final batch of questions.
Let me start with the 88 district hospitals. Things are on course, and God willing, before end of July, we will see the launching and the short-cutting of the project, the 88 district hospitals. It is no more 88, but we now call it Agenda 111. We've added on, because when we picked 88, there were complaints from some districts and some regions, and when we went to do investigation, truly, their complaints were genuine, and so we had to add on. I don't even know by the time we complete how many we might have actually added on, but that is work in progress. A lot of things have been done: land acquisition, inspection, soil testing, designs. All that is virtually completed. Even our letters have been given, so people have been selected, and by end of July, we will see action in progress. The vaccine issue, production. The government has set up a committee for vaccine production, chaired by the Minister for Environment and Science. They have also done a lot of work. Committee members are picked from the scientific world, some in the ministry and other scientific institutions. They are working very fast. They have even visited, and they are partnering with private sector companies that were originally also preparing to produce some semblance of vaccines in our country. looks like 3 of such facilities have been picked up. And they are liaising with the international community to see how they can start working. Their strategy is to try to do what they call filling and packing first, and then the science community will also take some time to start developing vaccines in our country. So that area is also seriously being considered, and we are actually on course in that direction. Thank you.
Minister, thank you. I'll take a final batch of questions. There's a gentleman in white, there's Ghanaian Times, Akable, and then I'll take the last 2 here. Not more than 2 questions each. Not more than 2 questions each, because we're running out of time. Let me start with you. Yes, sir. You've had a question already. So let me go to the other gentleman in white. Yes, sir. Not more than 2.
All right, I'm Trevor for EBN TV. My question will have to do with the blood bank. There was an incident at Ridge Hospital, Greater Accra Regional Hospital. I was there myself. Some men have donated in advance, pending the CS for their wives, only to be told that morning that there's no blood, while the wives were prepared for CS. And I'm sure such incidents are the kind of incident that discourages others equally from contributing. Initially, you used to work in tandem with Ghana Education Service, and you go to schools for this kind of donations. What has happened? What can we do as far as this is concerned? Because it's an alarming situation.
Thank you. So the question is, what are your plans to ensure that you're able to get supply up? Colleagues, let's keep our questions as quickly as possible. Ghanaian Times, not more than 2. Then I'll go to Akable and come this way. Not more than 2 each. Let's be quick.
Thank you very much. Minister, last year, the president cut short for a number of hospitals to be constructed, including that of the La General Hospital, one at the Tema General Hospital, and other places. I would want to find out the status of work. Why hasn't actual work commenced in some of these hospitals? My second question is it true that we are beginning to see an upsurge in COVID-19 cases in the Ashanti region? Thank you.
My minister presented the data, correct? So I'm sure that question is self-answered by the data that was presented. Akable, not more than 2. So, Minister, the question that I'll come to you on is, and I think while at that, you have to clarify. When sometimes politicians and project managers say that work has started, doesn't necessarily mean that blocks have started going up, or there's some work that starts, which is work has started, but you will not necessarily see blocks up. And while at that, please respond to the question of people who haven't seen blocks going up in some of these projects. What do you say about it? Joseph?
First, on our engagement with middlemen for the vaccines, I just wanted to find out what specifically is the way forward. And I'm asking this because the statement from the ministry earlier indicated that there's the option of terminating the agreement if the supply delays. Here is the case. It tells us that there was an issue with the LC being available early. He again says that in terms of the $19 deal, they have up until July to supply it. So I wanted to know what is the decision related to that. And the second issue has to do with the $18.5 one. He didn't give any details on the current status. And the other question, maybe it's a question that Mr. Minister,
you
can
have
answer.
Actually done 2 for me. You've done 18 and 19.
It's one question.
Let me take your other colleagues. Joseph. No, go ahead. You ask.
No, it's a question for you.
For me, go ahead.
It's about the COVID compliance issues.
Mm-hmm.
What's the latest on the fallout from Sir John's funeral, Kojo Usefriye? The latest I heard on it is that an individual, a gentleman, was claiming that he had been invited and interrogated by the police. But I mean, it's an issue of concern. Health experts say that it's something that government should take an action and send the right message, especially because high-ranking public officials were at a program that experts say were obvious disregard for the COVID-19 protocols. I
don't have an update on that. I would have to get you an update on that one. Abednego, quickly, then I'll come on these 2.
Good morning, Honorable.
Yeah.
Your friend Abednego Santia Sidu. Me ajuma wa Dom FM. If I show me question.
And I was ID Obedi Nansani Nana.
Nansani.
To as well it.
Me da say, Honorable. Honorable, my question is your card be circulating on social media. I trust the COVID-19 vaccine passport. If I see me say government are rolling out some policies say who to coin and say obi okoba bi card be or high COVID-19 vaccine passport.
Dr. Bade, patch on your question we say obi yan wo chimu. Yeah.
Okay. And then agenda 1, Deputy Minister designated for Health, or appear before appointment committee, of Parliament, Okay, say so far, versus 75 of the contracts has been awarded. Versus honorable, maybe say, Niakano, our contracting. Every number of the contract,
First of all, they are nominee no kind no crana because no onyan do ministry work crana. Yeah. Until they are no eka. And we are no crana. But I'm say Minister the can say some award letters have been given, and that by 1st July, some more details will be provided. Until Yaman on 1st July no, and I say July no kind, not 1st July, July. Now, omoma the data on that one. Nana. Not more than 2. Let's make it snappy.
Yes, sir. Good morning, Honorable Minister. I have 2 questions for you. You said that the National Identification Card can be substituted for the National Health Insurance Card. What are the processes? Because a lot more Ghanaians will want to hook onto that thing because it becomes very easier.
NHIA.
Containing many cards on you, I think, is very cumbersome. So what are the processes one has to go through to access that this thing? And then my second question. The same health insurance. We were made to understand that before you pay claims, you do some pre-auditing and find out the problems, whatever, associated with it. People either inflating or over-invoicing their bills. Is that still, unit, is it still existing, or you have done it? Because the minister said that you are going to set up an intelligence unit. So if that outfit is still existing, why they need to set up that intelligence?
No, the intelligence unit is at the ministry, correct?
So I want to know whether that
is not about health insurance.
Yeah, pre-audit this thing is still existing. And what is it doing now? Thank you
very well. So NHIA, 2 questions for you. The NIA card, NHIA, how does it work? And is your pre-auditing exercise still ongoing? And maybe while at that, does it make an impact? Final.
Okay. Honorable Minister, good morning. Please, my name is Emmanuel Boxen. I write for the Daily Graphic. My question has to do with, you said there's a new vaccine order that we are making, and it's supposed to arrive somewhere in August, Johnson & Johnson. I want to find out, is it something that we are paying for, or is going to be like the COVAX scheme? Yeah, that's my question.
Thank you very much. So health insurance will take their questions. I think I've outlined them. Yeah, NIA, NHIA card synergy, and then whether your pre-auditing is still working. Then, Minister, I'll come to you to answer the question on construction. When sometimes you people say work has started and we are not seeing blocks, what does it mean? And specifically like general, etc. Director of Infrastructure is here. Today you have to earn your salary some more. You come and join me and then answer. And then, Minister, you answer the question on the way forward on the $19 and $18.5 questions for us. Chief, we're with you.
Thank you very much. At our NHIS launch last year, we publicized the 7 steps to link your Ghana card to the NHIS card, if you have one already. The challenge is people have different names, different date of births, and all sorts. So the 5 or 6 key indicators to be able to link are completely different between the 2 cards they are holding. So only about 100,000 have been able to do the link by mobile phone themselves. We are piloting in 4 districts in Accra. You going to the office to be able to do the link. And then after that, you can use your Ghana card. All the hospitals have been trained to accept the Ghana card, all the clinics. It's the same mobile technology that they will use to authenticate you when you go there. So there are 7 steps. I will get my team to do a bit more publicity around that 7 steps. But it's the same star 929, and it comes up linking your Ghana card to NHIS card. Star 929 hash. You can just follow 7 steps, and it will link the 2. And
star 929 hash. So that's your answer.
So from there you can do it.
Yeah. Pre-auditing, is it still happening?
Yes, we have claims processing centers that look at all submitted claims. Obviously, if you submit it electronically, we have some level of artificial intelligence that does a lot of the vetting. If it's manual, then unfortunately our staff have to manually go through. That is why we give ourselves 2 months from date of submission to be able to pay the claims, but it still goes on.
Thank you very much. Ghana Blood Service, what are the steps you are taking to ensure that you are able to step up supply? After that, I'll go to Ghana Health Service. To come up and answer your questions about the vaccine passport.
Okay, thank you very much. Last Monday was just World Blood Donor Day, and it's a day that is set aside for us to recognize the importance of blood donations as part of healthcare systems. And the whole of the month of June is also declared an education month, blood donation month. So we do a lot of education. But to answer your question, what happens is that we as a country are not self-sufficient for blood. We need 1% of the population to donate blood so that we can be self-sufficient. But we realize that our blood collection index per 1,000 population, which means the number of people who donate per every 1,000 population is about 5, when it should be about 10. So we are not, adequacy is a problem, and also we're not having a lot of voluntary donors. COVID really affected us. At the end of 2019, voluntary donations were 33%. At the end of 2020, it was 17%. So it really, really went down. But to answer your question, what could have happened is that probably the blood was not available because people are not donating blood, or the blood group that was needed for that person was also not available, because we need to have all the blood groups available at every time. So my appeal is that we are doing a lot of education to get people to donate, 17 to 60 years to donate, but even people who cannot donate, you can have advocates, people can volunteer. We're doing a lot of education, and we think that if we can all put our hands to the plow, we'll have enough blood, we'll have enough of the blood groups so that when people need blood, they would be available. So my appeal is for all of us to put our hands to the plow.
Thank you. I'm going to take you up on that offer. Colleagues in the press pool, we're going to invite you one of these days to come and join us for a blood donation exercise here at the ministry. I hope you will join us. I hope you join us so that we all contribute to fixing the challenge that they have there. Okay? We look forward to it. Thank you. Ghana Health Service, COVID passport. Minister, I'm sure you'll join us for the blood donation on that day. Yeah. Your age. We'll give you special dispensation to join us.
I think I bet no guys because I have to answer.
Yes, Chi.
I'm say COVID now bano. Any say bedroom rebino. Okaswa vaccinated. Ibusa say. DNA say you vaccinate you. When say EU for started so much can be na ebogu ye na WHO say entwen kakra. But him say a drum rebia sade na beba say. Me see a vaccinate me anya say me kwa say me tiwe countries be a chere omo de omo card abre say. So you ba okroma no kuto fi take here card okuta say vaccination card ni. Yes say they come for na first they come be a country be as a Ghana neighbor and vaccinated and look at that card we are and non actually say as the way say passport near that in there at the floor. But a no sentina what share Ghana card now your body will share QR code actually your scanner a bachelor say I am say I vaccinated and yes I will be able to me I could church will be at the aba. Then him say nearby and the same say kolebu bibitisa. To say card be na near stop home into side no is all being withdrawn into be you soon a card no kuta no say udu krobi so let's almost say I am passing our vaccinity of our card bra now they are sharing some friend the passport to some friend you it's a way of say verify some pass why vaccinated near say batch number the boy no no cre and I say times and the boy on the second dose no protective one who say betimi I no idea yeah, going to Sadia no. I'm say kolebu but I withdrawn to be a card okuta no. And then the best sell. I mean, it's just a bedroom maybe no. If you are seeing a special card, bo has a yellow fever card here no. Bohun saw that betray say. And on nature say my vaccinate me to show say won't fire and come over and also console out to me pick here any be. Honorable Minister, I think that's the
I want to invite the Honorable Minister to respond to the final batch and then we'll wrap up. Minister, so construction, and specifically he was asking about La General. Director of Infrastructure, you take that one for us. The Minister will now do the way forward on vaccine procurement, and while at that, the August expected vaccines, whether it's COVAX or it's by purchase. So this is the Director of Infrastructure. He's the one in charge of, the construction.
Okay. Thank you very much, Mr. Honorable Minister. And good morning, ladies and gentlemen. And just as it was really indicated, when we come to projects, there are a number of processes that we go through. Those projects that were commissioned, that the President, His Excellency the President, cut short on. There were a number of them. I just want to run through and give you an update on how far we've come. The completion and equipping of the Confanachi Maternity and Children's Block. The construction of the Eastern Regional Hospital. Construction of the District Hospital at Obuasi, Enyinem, Enyiresi. Rehabilitation and re-equipping of the Shama Hospital. Construction of the Shama La General Hospital, 180 bed. Construction of the Urology and Nephrology Center of Excellence in Kolebu. Construction of 300 beds maternity block in Kolebu. Then a construction of the Tema, I think this issue came up, construction of Tema, Nkransa, Doma hospitals. And then again, the construction of 12 number hospitals in Jumapo, Kwabin, Nkwetia, Edukrom in the Eastern region, Achiase, Swami, Drobonso, Sabronumu, Manson Kwanta, Twedie in Ashanti region, Mem in Ahafo region, and also Pon Katamanso in Greater Accra. The rehabilitation of Efian Kwanta Hospital, and then the construction of other hospitals. What is happening is that as at the time that the President did cut the sword, we had actually laid all these projects at value for money. As I speak with you, the projects are almost at the tail end of the completion. There are some of them that will finish the value for money. Value for money has already been completed on them. For instance, a place like Koforidia, those of you who bear me out, you can go there and I realize that the constructor has already moved to site. What is happening is that once the project actually gets started, or once the contract is firmed up after VFM, it takes almost close to 4 to 6 months for you to complete the pre-contract activities, where you do a geotechnical analysis to know the nature of the soil, so that it will inform your designs that will come up. We go through all this process. You will do what we call a stakeholder engagement with the beneficiary facilities, so that we'll be able to finalize the design before the contractor actually moves to site. So even though the contract might have been signed, it will take almost close to about 6 months before you see the project actually coming up. So that will also account for some of these delays. But I can assure you that, like those places that I've talked about, Kofredi had started. Maternity in Confanochi is already ongoing. Tema, we have just completed all the conditions precedent for contract effectiveness. And I can assure you that hopefully by the end of June, Tema should take off, because we've been paid advance mobilization to the contractor. Tema, Nkransa, Doma, and also the reactivation of the central medical stores are also going to be completed in that batch. So all the projects that I've actually talked about, it was in no time. I'm hoping that by the latest, by end of July, you will see all these projects being rolled out. There are about 35 of them in all. So that is what I can say.
Thank you. Thank you so much. And colleagues, I think there's something very important in what he has said. The role of the media is to inform, to entertain, to educate. It is right for citizens to say, we saw sword cutting, we haven't seen the building. But we are being educated about what goes on in the first 6 months. I want to implore you to also take opportunity and educate your audiences that apparently something goes on for about 6 months before you start seeing blocks, so that the expectations of the citizen in a democracy, which is met by factors including information, you provide the citizen with that information that, oh, actually, within the first 6 months, there's soil testing, there's design validation, there's all of these things that goes on. You may not necessarily see the building, but it doesn't mean work hasn't gone on. And that is why, assuming they present a report, they'll say ongoing. And then sometimes you find somebody who will go and stand there and say, look at me, I'm standing at the place, look at me, behind me, there's nothing ongoing here. But there's a technical explanation for that. And it is important that we understand and that we can also educate our audiences. Minister, I'll give you the final word on the way forward on the vaccine programs and whether the August vaccine is COVAX or by purchase.
Thank you very much. The status of the 18.5 and the 19. If it was in April or March this year, when we had that massive upsurge, I don't think we'll be asking about the status. People will rather be pushing me to move very hard. But because we've managed ourselves to this extent, and things are a bit slow now, we think that it is gone, so we should be careful. I will link this one to the Johnson & Johnson question. Kwajo. COVAX is giving us, initially they said 20% of the population for free. Then later they said they will increase to 30%. That is not confirmed yet. To vaccinate the rest of the population, government itself should find the vaccines. So far as we are not producing, it means we should procure from somewhere. So Johnson & Johnson, we are buying. We have even made some 15% deposit to get ourselves properly situated on their platform to show commitment that our order is backed with some political will. So we'll begin to receive in August. Now, we are finding challenges with bilateral engagements. I've mentioned Russia, but we needed vaccines. So we had to utilize people who claim they had authority to sell for Russia, and that is what we were doing. The LC that we did, we are still waiting. The schedules that we have in the agreement becomes effective. The agreement becomes effective after ordering and issuing letters of credit. Because they haven't been able to supply us even with the first 300,000, we have to hesitate a little bit to make sure that they are going to perform before we do the next LC. The Russian agreements are about similar. So the second one we even did, we're only hesitating to see if the first one can actually bring before we go ahead to try to do the LC for the second one. Whatever it is, we may have to procure. And so far as we are getting bilateral engagements to do, we wouldn't have options than to continue to engage middlemen to some limited extent. Thank you.
Thank you. Minister, I want to thank you. Member of Parliament for Doma Central, Minister responsible for health, giving us a brief this morning on three major things.
And this is JoyNews Desk. Welcome back from the Information Ministry, where the Ministry of Health and other officials within his ministry were answering questions from the public on a myriad of issues of concern to the Ghanaian, particularly on the COVID-19 vaccines, the construction of hospitals, and a number of other things coming up there. We'll bring the bulletin to an end here, make way for Bernice Abubedu-Lanza to bring you JoyNews Interactive. But remember, when we come back at midday, we'll tell you how the local popular millet smoothie, Burkina, has been found to be contaminated with high levels of unacceptable E. coli. We'll tell you what that means, especially as we speak to researchers at the Kwame Nkrumah University of Science and Technology at midday. See you then.